Thank you very much. So I'd like to acknowledge our wonderful project team, myself, Sharon Hills, Tracy Robinson, Catherine Hungerford and Denise Harrington. We've been lucky enough to have the involvement of some wonderful general practices in this project: Wakefield Garden Surgery, TMS Healthcare and Fisher Family Practice in the ACT. We have a representative down here, Stacey, nice to see you here. In Victoria, Carnegie Medical Centre, and I don't think Kathy Carrasco is here, but you'll certainly know her by the end of the conference, I'd say. Echuca Moama Family Medical Practice up on the border between New South Wales and Victoria. Frankston Healthcare, St Kilda Medical Group, Denise and Sharon here, and Wellness on Wellington. These 8 practices have been wonderful contributors to the project, and it's enabled by engaging those practices over the period of about 2 years. We've been able to get a really good representative sample across different kinds of settings, including rural and metro. And I must acknowledge the funding support we received from the Universe Foundation in Japan, who have funded key parts of this project. So by way of background, anxiety in later life is a worldwide concern, and we've found that clinically significant symptoms may affect more than 1 million older Australians. It's quite surprising, really. Anxiety in later life is associated with other physical and mental disorders, reduced quality of life, disability and increased healthcare utilisation. The thing is that diagnosis can be easily missed. Older people with symptoms are more likely to present with somatic complaints. Many symptoms are similar to medication side effects and other disorders, and older people may regard their symptoms as an expected part of ageing, and unfortunately many clinicians may agree with them. Erroneously, I would contend. So some of the issues surrounding this area, the symptoms of anxiety in later life, are often unrecognised, preventing early diagnosis and treatment. Now, to date, most available screening tools are really not that appropriate for use with older people. Their shortcomings are certainly in areas relating to clinical and psychometric utility. We have found, though, this wonderful Australian developed tool, the GAISF, has 5 items developed and validated for use in primary care. It's been tested for broader application beyond that too, and it measures anxiety symptom severity. So it gives us a good marker of when somebody has clinically significant symptoms of anxiety. Primary care settings are ideal for the screening of anxiety in older adults. We believed it was readily incorporated into the annual 75 plus health assessment in general practice, which are typically nurse initiated in the home or practice setting, and of course there are Medicare benefits payable on that. The main issue here is that, or the hypothesis that we're testing really is that with accurate screening, general practices can take the lead in reducing the burden of the disease through early diagnosis and the implementation of appropriate treatment. So in the first part of this study, we were wanting to increase detection rates for anxiety in older people, and really to try and ensure referral for medical assessment and treatment where this is required. It's a multi-method feasibility study across general practice in ACT in Victoria, and we were looking primarily at the feasibility and effectiveness of a screening protocol. So general practice nurses utilised the GISF in the 75 plus health assessment, and then that was accompanied by a simple, though optimised, referral pathway for GP assessment and treatment. And of course, by doing this, we were able to get prevalence estimates to find out how much anxiety there was out there in the community. So these are our results to date across 8 practices. As of the end of last month, the overall prevalence rate of clinically significant symptoms of anxiety in 75-year-olds and over was around 20%. And this is about the average of the results in the broader literature, though there is wide variation, because usually they're very small studies. And if the reason why I displayed it in this way is to kind of give you an idea how much variation there can be. If we were to think of one general practice being one small study, it varies quite a bit, although the bulk of the results for practices are still around that 20%. And I think the first three practices are the ones in the ACT, by the way, and the rest in Victoria. So when we think about the results to date, we have found that the GAISF, this 5-item instrument, is really easily and effectively integrated into the 75 plus health assessment. The feedback is that it's very acceptable to older people. Its use can improve the likelihood of effective medical assessment, diagnosis and treatment where required, and we have at least anecdotal evidence of GP acceptance and utilisation. One of the things that we have found, though, that current treatment and referral options don't seem to be that appealing to many older people, and we draw that evidence both from feedback from general practice nurses, some medical practitioners, and also from the literature. And really, this evidence suggests that treatment options like medication, CBT, cognitive behavioural therapy, older persons' mental health services and so on may not be acceptable to many older people. And issues there can really include things like the cost of therapies, challenges accessing practitioners, and reluctance to engage with mental health services. So I think this project's been very successful. It's given us a good direction for where we need to go next in looking at this problem of underdiagnosis and under treatment of anxiety in older people. So the developments now are that we're working up a project on anxiety in later life, but it's a screening and intervention study. So we're going to be looking at an intervention feasibility trial funded by the Nurses Board of Victoria Legacy Limited, and we're seeking further funding to trial in regional and rural areas. We want to test the effectiveness of a customised step care intervention, and actually what it is a relaxation activity with scheduled follow-up sessions. This is a nurse-led intervention that we want to be trialling. We're almost ready to commence recruitment of practices into this new part of the study, stage 2 of the study. So just concluding, clinically significant symptoms of anxiety in later life are prevalent, and we're looking around 20% of 75 plus year olds, and our sample is approaching 700 older people in the ACT in Victoria. It's feasible to use a structured nurse-led approach to early identification using an appropriate and validated tool, and that is the GAISF. It's not our tool, it's developed by other researchers. It's readily integrated into the annual 75 plus health assessments, and that seems to be the most appropriate place to use it at the moment. It may be crucial in mitigating distress and disability and improving the well-being of up to 1 million older Australians. So that's like the big aim, is that we are able to set this project up and be able to roll it out across the country. I would say that general practice nurse-led intervention feasibility trial is just about ready to commence, and I'm really looking forward to seeing how that's going to work. And if it is indeed able to provide an answer to how we can relatively easily, address this very major problem for many older people in Australia. Thank you.
I imagine those numbers are going to be increasing over the years. You mentioned there 1 million with the ageing population, I imagine those numbers, are there any predictions on what the numbers might increase to over the next decade or so?
Well, I know the population, like we have a bit of a population triangle, like that's more that shape, and it's bulging now. So as I don't know, over the next 20 to 30 years, that bulge will just move up. And we're going to have a cylindrical population distribution of young people and many older people.
Yeah.
So it's likely to be a continuing and growing problem.
Yes. So
unless we do something about it.
So possibly a major role there for practice nurses, I imagine.
A major role for practice nurses, very definitely.
All right, well, I've got a few questions at the end as well. So let's keep continuing, because I know someone needs to catch a plane at the end of this session, one of our speakers.